Hello everyone, Dr. Fink here. Today we'll talk about testosterone cough, tren cough, or any cough that is in reaction to an injection of anabolic steroids. Quick disclaimer, this is not medical advice, this is entertainment only. So for those who are on TRT, testosterone replacement therapy, or those individuals who are injecting anabolic steroids, you might have experienced that right after an injection, you have to cough really, really, really hard. This is called testosterone cough or tren cough, and it is basically a reaction, a very intense reaction, a very scary reaction of your body to that injection. So how does this happen? So let's say we have our muscle tissue here, and as you know, we have capillaries all over the muscle tissue. And now we are about to inject. Let's say this is the glute. This is the glute muscle. Okay, so we are in the muscle here. And here is the injection. Boom. And now we are injecting the testosterone, which is an oil-based solution. And the solution will get into the muscle tissue. So here, no problem. The oil went into the muscle. There was no contact with the capillaries. Let's draw a different situation. Now, here, the oil comes in contact with the capillaries, which are tiny blood vessels in our muscle tissue. What happens when the oil touches those blood vessels, those capillaries, then we react, okay? It goes systemic and it goes immediately to the lungs. And the cough is that reaction to that oil getting in contact with the bloodstream, which is sent to the lungs. All right? So, for the most part, we should be able to inject in an area without touching those capillaries. But when it gets dangerous is when you inject over and over and over in the same site. Let's say you always inject in the right glute, then you will build scar tissue. You will irritate the tissue. The tissue will become inflamed. What happens if the tissue is irritated and there's a lot of scar tissue? Then there are more and more capillaries that will surround this area. And the potential, the risk of hitting a capillary, a blood vessel, is getting higher and higher. That's why it is crucial to rotate injection sites and avoid the buildup of scar tissue, the buildup of irritation, inflammation, which lead to a more dense capillary network in that area that leads to a higher risk of touching one of those blood vessels with the oil solution. So now you'll ask, is there a difference between the different oil solutions? Testosterone cypionate enanthate is usually in grape or cottonseed oil, and it usually doesn't make a big difference which oil it is, as long as the oil touches those capillaries. The cough, this intense reaction, will usually happen. So in order to prevent that, make sure You rotate the injection site, you inject deep into the muscle, and inject slowly. All right? So again, this is not medical advice, this is entertainment only. If you have any comments or questions, please do that below. Thank you for watching and see you the next time.